Hi, I'm Jodie Franzen, Director of Performance Excellence at DRH Health. To start our SDOH screening process, I worked with our Chief Nursing Officer and our Head of Case Management or Social Work. We used the screening tool that CMS put out in order to develop our screening questions. We pretty much used the exact language of the measures that CMS put out, all the way down to the opt-out language. Once we had the questions, we built them into our hospital's inpatient side first. So we were asking all of our inpatients, our birth center patients, our joint replacement center patients. And then we rolled it out to some of our outpatient services, our outpatient therapy, and our jury psych services. At each location, I consulted with the nurse navigator or the nursing supervisor to decide where in our EMR to put the screening questions. And in all of our locations, we decided that our admissions assessments would be the best place. It only took us about a week to build the SDOH questions into our EHR. Our nurses and our case management department are already used to doing so many screenings that it really just became a part of their admission screening process. The MetaSolve Equitable Care module so far has really just been a godsend for me. It's so easy to get the data nearly real time and to also be able to sort it and just look at it in different ways to evaluate the data that's coming in. The biggest challenge that we've had with our social determinants of health screenings is some of our staff aren't comfortable asking the questions if they don't have the answer, particularly to a yes response. In order to address their concerns, we've developed some one-page handouts for them to be able to provide patients with resources. So if the patients screen yes to transportation or to utilities, we have handouts that they can go over and provide to the patients. With nurses and with case management, it really wasn't much of a challenge to do these questions, but with our outpatient therapists, they just aren't really used to asking these kinds of intimate questions with patients. So they did ask our head of social work if she could give them some scripting on how and why they're asking these questions so that they felt a little bit more comfortable with the process. If you're just starting to develop your SDOH screening process, the very first thing that I would do is develop your list of resources. This will provide your staff with the tools that they need when they get those positive responses, and they'll feel more comfortable asking the questions right away.